Thank you, speakers and chairpersons. Now we move on to next session. Can I please request Dr. Ishita to introduce our chairperson for
Sure.
the session?
Well, Dr. Rajiv Chawla himself does not require any introduction as such, but he's been a DNB teacher and guide for 20 years now. He has had more than 95 papers on micro and macrovascular complications of diabetes. He's authored multiple textbooks. He has had multiple oration awards. He's been the past chairman for the RSSDI Delhi chapter, past secretary of the national body RSSDI. And he has also been the president for DIPSI in 2019 and immediate past president of RSSDI. So, and the next speaker, Dr. Saurabh Mishra, sir. He is in charge of the emergency at Regency Hospital, Kanpur. He's also been a consultant physician and diabetologist at Mishra Polyclinic. And he has also had multiple presentations on national and international level. He has done a poster presentation for IDF in 2013, and he had a paper presentation in IDF 2019 in South Korea. Got a National Dicon Award in the Rising Star for the diabetes care, and using Guard Iron Connect plus ambulatory glucose profile on a good number of patients. And over to you, chairpersons.
Thank you, Dr. Gupta, for such a nice introductions. Now I would like to invite our mentor, co-chair, Dr. Rajiv sir, to introduce the speaker so that we can start the session.
Thank you. Good afternoon, everyone. And at the outset, I am extremely thankful to my very close friend, Dr. Bansi, Dr. Amit, Dr. Parekh, for this opportunity to be part of very, very prestigious Diabetes Technology World Congress 2022. And that too, chairing this session, which is very, very important oration, JP Bose Oration. So many of us actually may not be knowing too much about Dr. JP Bose. So I think it's my duty first to give you a few lines about Dr. JP Bose, who did his MB from University of Calcutta in 1990. He was officer in charge, Diabetes Research Center, School of Tropical Medicine, Kolkata. He made significant contribution to medicine, particularly relating to field of pregnancy and diabetes. And he has, for the first time, showed as early as 1922 what are the causes of glycosuria in pregnancy and how anterior pituitary gland plays a very, very important role. And he also worked on potency and qualities of insulin in considered highly significant amount. He also authored Handbook of Diabetes and its modern treatment. And he was a fellow of Chemical Society and a recipient of Minto Medal in 1935. And he was one of the first one to use insulin in India as early as 1923, almost a century ago. And I'm extremely happy that this prestigious Dr. J.P. Bose Oration is being conferred upon none other than on Professor B. Mohan, who is not an international authority alone. He's always like a mentor, a guide, like an elder brother to all of us, and he has handheld all of us to this field of diabetology. May I have Professor Mohan's slide? In fact, introducing Professor Mohan is extremely difficult because it may take itself an entire session, but I think still in brief, he's chair Dr. Mohan's Diabetes Specialty Center and president Madras Diabetes Research Foundation, Chennai. His main research interests are epidemiology of diabetes, its complication, genomic research, fibrocalculus, pancreatic diabetes, and precision diabetes. He's in fact one of the few scientists, those who have actually established the concept of precision diabetes over last 10 years. And he has been conferred upon fellowship from all 4 Royal College of Physician and also from Academy of Sciences and fellow of Indian National Science Academy. He has received more than 190 awards, including prestigious Dr. B.C. Rai Award. And he has been conferred upon the most prestigious civilian award by Government of India in 2012, what is Padam Shri. And I know he has almost now close to 1,500 papers in peer-reviewed journals and textbooks, and his articles have been cited like anything. Has for one of the highest index of citation on his article, and he is also an author of book Making Excellence and Habit. And I always say that possibly this reflects your own personality, because you have made and use excellence in every field whatsoever you have touched upon. And other day I was in a lighter vein talking to him. I told that you must be publishing an article every 7 day, and he corrected me, Rajiv, no, it is every 5th day we come out with a quality publication. So to me, in this part of the world, he's possibly the man who has not only researched diabetes but popularized diabetes across the globe, and possibly he's the person for whom we as an Indian stand very, very prouded once it comes to field of diabetology, Dr. Mohan. And I'll now request my co-chair to felicitate Dr. Mohan with a shawl, with a citation and a medal, and then request Professor Mohan to start his oration. Dr. Saurabh?
Maybe I can give my talk and we can do that.
Maybe. Okay. I think we have lost Saurabh.
Yeah.
So it is great privilege, sir, for chairing this session and inviting you to deliver this prestigious Dr. J.P. Bose oration. Dr. Mohan, please.
Yeah, sure. Oh, thank you, Dr. Rajiv Chawla, for those very kind words. I would also like to thank Dr. Banshi and Amit and Rakesh and all the organizers for continuously organizing academic meetings. Hardly 1 week passes and the next meeting comes along. I don't know how you do this. But when they asked me to deliver this oration, I was quite emotionally attached to this, because I had the good fortune of discovering the legacy of Dr. J.P. Bose, and who has been so beautifully introduced by Dr. Rajiv Chawla, that I can only say he's a forgotten hero of diabetes. And I'll come back to him in the oration. In the interest of time, once again, congratulating all of you for this wonderful 2 days of technology meeting. Let me go on to formally thank Banshi Sabu, Amit Gupta, Rakesh Parikh, Jyoti Dev, and all of you, the organizing committee of DTechCon. So the topic which Banshi wanted me to talk about is technological developments in insulin over the last 100 years. I work with several insulin companies, but I don't think they are relevant to this particular talk. So you cannot talk about 100 years of insulin without mentioning these 4 gentlemen: Banting, Best, MacLeod, and Collip. Each one of them played a significant role in, if you want to call it like a jigsaw puzzle of diabetes. More than 50 years before that, people had started trying to unravel the mystery of insulin. But it's only these 4 people, predominantly the passion and the work of and the belief of Banting that it could be done. It almost looks as if Banting was born to do this, because I don't think anything else significantly he did in his life except a few paintings. Now, officially, the announcement of insulin discovery was made on May 3rd, 1922. And although we say that insulin was discovered in 1921, it was only in 22 that the first insulin was given. So actually, this is the 100th year of the first injection of insulin. And it was in 1923 that insulin became commercially available. And in the same year, it came to India. So we're very happy to talk about that. And again, one cannot talk about the 100 years of insulin without saying that insulin is one of the best miracles of modern medicine. A child like this, emaciated, almost dying, being converted to a child like this, or a child like this, totally emaciated, becoming a young woman. These have, in the olden days, it was almost something unheard of. But today, every day, all of us are seeing this thanks to the discoveries made. Now, this is the first commercial insulin made in the world. And this is Iletin from Eli Lilly, 1923. And this was first produced and made commercially available. And of course, many other people, Novo was not at all far behind. Almost the same year, Novo produced its own insulin. And then this is actually taken from the museum at Toronto, where the history of insulin, it's called Insulin from Toronto to the World, and it showcases some of the early insulins which were made in the world, and you can see some more here. So we had protamine zinc, and we had sulfated insulins, and we had all kinds of insulin. You can see actrapid monocomponent insulin, about which I'll be talking about. So those are the early insulins. So the question, until 1 year ago, I think nobody knew when insulin came to India. In fact, I asked Novo, I asked Sanofi, I asked Lilly, I asked Biocon, I asked everyone, when did insulin come to India? Nobody seemed to know. And so that started off almost a 6 months research that I personally did, and dug up all the old papers published in India on diabetes between 18. So it's very interesting that up to 5th century AD, Charaka and Shushruta, very beautifully described. But from there, up to almost 1940s or 50s, nothing was known about diabetes. And of course, even still nothing is known until around 1860. So from 5th century to 1860, nothing is known. But from 1860 to say 1940, 1950 was the history that I discovered before independence. After independence, I had heard from my father, because he started in 1948. I knew about that. So I'll try to cover a part of it. But this is a very important publication. I would rate this as one of my best publications. I published it in Jp purposely because I wanted Indian physicians to know. I know that in Jp goes to over 25,000 physicians, and I wanted every Indian physician to know this history. And of course, one of the big discoveries was the contribution of Jp Bose himself, which is very nicely described here. In the interest of time, again, you can see this is March 1923, where in the Indian Medical Gazette, this is the journal which is largely forgotten because they stopped publishing it. But for all physicians and surgeons in India, this was the only journal. There was no JAPI, there was no physicians, there was no IJMR came along later, there was no surgeons journal. So any doctor in India wanted to publish, they had only one journal. It was the Indian Medical Gazette. And even the white people who worked in India used to publish in this. And there's already an article in this, Insulin and Diabetes in India in March 1923. And this, of course, is the first brand of insulin which came. It's called as the AB brand of insulin. This came from England, and it's called Allen and Hanbury's and the British drug houses. And therefore, it's called as the AB brand of insulin. So it wasn't Ileton which came. It was the AB brand of insulin. There are also a lot of articles about the price. And you can see the date here, issued May 1924. And the batch number is also there. But then coming back to J.P. Bose, J.P. Bose was the first to use and document the use of insulin in children. And this is in 1930, after he had treated quite a number of children with type 1 diabetes. And you can see how thorough he is. You know, he very beautifully writes. His English is also very good. And in this article, he talks about diabetes in children. And here he talks about the first child who received insulin. I was very, very curious to know. Everybody knows Leonard Thompson, but nobody knew until this article was published in Jp, who was the first Indian who received insulin. Turns out that it's this girl, Kumudini, who was a Bengali Hindu, aged 12 years. In fact, those days, child marriage was common. So she got married at the age of 11, and a few months later, developed all the classical symptoms of type 1 diabetes. And insulin had just arrived and was being used, and she was treated with insulin and made a remarkable recovery. The details of recovery are mentioned, but how long she lived and so on, we still don't have that information. And there are details of other children who were dying like this, who later on completely recovered due to insulin, just like Leonard Thompson also recovered. You can see this girl in a wheelchair now become a normal child. So the same, the miracle which happened in Toronto, those pictures which are shown should now be shown regularly. And these are all there in the Jp article. Now, somewhere in the 1950s and 60s, the Boots insulin, they started manufacturing Boots insulin in Mumbai. and the Boots insulin was introduced. I joined my father in 1971 at the age of 18. And at that time, what we had was plain insulin, Lente insulin, PZI insulin, and NPH insulin. And this is how the bottles of insulin looked like. The plain was in blue, and then you had this red or pink band across if it was Lente, and then you had the NPH insulin like this. The PZI was never very popular because of the side effects, but mostly they were from bovine sources. Later on, porcine came. Sometimes mixtures of bovine and porcine insulins came. An article was then written in the 1970s saying that these old insulins are dirty insulins, not because they're crude, but because they contain proinsulin, they contain glucagon, they contain a lot of them. The extraction process was not perfect. This therefore resulted in insulin allergy, lipoatrophy, hypertrophy, insulin resistance, and antibody formation. Those of you who are older and have seen patients in 1970s and 80s will recollect that we used to get severe insulin allergy. You inject insulin and they used to get insulin allergies. In fact, in 1980 itself, we published this paper on insulin antibody levels. And you can see related to the duration of diabetes and how many years it took and how many patients. Already there were articles on this. Then came the purified insulins. The single peak insulin was introduced by Lilly, but it didn't really take off in India. When I was coming to my final year, fourth year, final year MBBS, Novo introduced the monocomponent insulins. Novo did not exist as a company in India. They had a partner, Ranbaxy, and through that, the Novo insulins were introduced. But we started using them. We are probably one of the first in the world. It had just been discovered, and we started getting it in India. We could see dramatic decrease in allergy and lipoatrophy occurring. But even with the purified animal insulins, which came, including the monocomponent insulins, there were problems. First of all, shortage, and I'll come to that in a minute. Then there were religious prescriptions. For example, Muslims did not want pork insulin. Hindus did not want beef insulin, but there was no choice. And therefore, we had various imams saying that if you're going to die, then you might as well take pork insulin. And they were given exceptions and so on. Of course, the allergies continued, because there were still differences from human. And lipoatrophy, I used to see quite commonly in those days. And this is one of our reports of the allergy to monocomponent porcine insulin. And you can see this 1983. By 81 human insulin is discovered. By 82, we already had human insulin. And we had one case of human insulin allergy, one of the first described in the world at that time. Now, we then started measuring antibody levels after introducing monocomponent insulin therapy. And you can see these are the antibodies were routinely measured in our center. And you can see the huge antibodies which are there. After treating with monocomponent insulin, the purified insulin, you can see the antibodies have come down dramatically over a period of few months. And of course, the insulin doses came down. And so you can see how technology is already developing quite rapidly, even 30 or 40 years ago. But then we got the shocking report in 1975, actually, where the NIH produced, at that time, only bovine and porcine insulin was there. NIH made some projections, and they said that the insulin production can go on like this up to 2000 or beyond, but insulin need or requirement, the demand, will go up so much. So supply is only that much, but the demand will go that much. And in 1975, they drew a line, and they said in 1992, the world will end for all type 1 diabetic children because there won't be enough insulin. You can't get enough pigs. You just cannot get enough pigs. You can keep on making millions of pigs, but the human need will go up so much. This is a prediction made in 75. I was in fourth year at that time. And I remember reading about it saying, oh my God, all these children are going to die in a few years' time. But then necessity is the mother of invention, as they say. And then the recombinant DNA technology was produced, and there will be never, ever a shortage of insulin in the world. And you can just see 30, 40 years ago, we did not even know whether we will have enough insulin in the world. And this is, of course, how the first human biosynthetic insulin was made by E. coli bacteria, by introducing the gene for the A chain of insulin and B chain of insulin, and then by air oxidation, join these molecules and then make it into insulin. Novo initially took semi-synthetic insulin. They took the porcine insulin, removed one amino acid, put the new amino acid, and made it. But they still needed the pigs. So then they've used yeast, and then they were able to do that. Today, of course, human insulin is made by many people. Now, there are problems with human insulin as well. Although the structure is exactly the same as human insulin, it has a slower onset of action. Therefore, it has to be given 30 to 45 minutes before meals. Those of us who use the regular human insulin today, we know that you have to give it 30 to 45 minutes before food. And you also know that you get late hypoglycemia. So then the genetic engineering went to the next stage, and designer insulins started being produced. And Lispro was produced by Eli Lilly, and Aspart by Novo Nordisk, fast-acting Aspart again by Novo Nordisk. And then long-acting, various tinkering of the molecules took place. Initially, we were very scared because we said, if you start tinkering with nature, then you may get tumors. You may get malignancy. Indeed, it took a long time because, and I could see how cautiously Dr. Anil Shende was answering when you asked about will human insulin, will the oral insulin come in next year? He was giving very guarded replies because you have to be sure that the molecule is safe before you give it in human beings. But then, of course, the longer acting insulins, Glargine came, Detamir came, Degludec came, and then the co-formulations also came. And what happens is that in these analogs, because they exist in a monomeric form, whereas the human insulin exists in a hexameric form, the hexamers have to be broken down to dimers, and dimers to monomers. It takes about 30 minutes. But since analogs exist in monomeric form, they can be absorbed very easily into the blood, and therefore you can give it just before the meals or even after the meals in children. And this, of course, is perhaps one of the best designed insulins in the world, the only co-formulation of insulin, where you have a long-acting, ultra-long-acting Degludec, 70%, and a short-acting 30%. And the beauty is that both are maintained nicely in circulation, as shown here. And this is not
the distinct clinical profile of this combination. The distinct clinical profile of this combination is derived from its specially designed co-formulation of insulin Degludec and insulin Aspart. Insulin Degludec is the first basal insulin that can be combined in a soluble solution with a mealtime insulin, such that both insulin molecules remain structurally separate.
So in the interest of time, I'll go on, because what they're saying is that they're co-formulation, not mixed, because even though they exist together, the long-acting one can keep working while the short-acting one can also work. Now, talking about the concentration of insulin, for many years, we had only U40 in India. Then U100 came, there's a lot of confusion. They'll use the wrong syringe and the wrong insulin and so on. Now we know that we have U200 insulin, we have U300 insulin, Glargine, and so on. And of course, if you have higher strength, you need to use much lower volumes, and therefore the pain is less and the volume that you inject is less. Then came the biosimilars. And we know that many companies, including some of the innovator companies, are producing biosimilars, because you can, once a patent is off, they can make the biosimilars, which they can tinker a little bit more and make them more easily available, and the cost also comes down. So I'm not going to go through this, but right from 1920-22, you can see that so many things have happened, including inhaled insulins. And of course, new ones are also going to come, the smart insulins, the pegylated insulins, and so on. There were some questions about once weekly insulin. And we have, of course, some of these are not insulins itself, but you have the oral insulin, which is Tregopil, and then you have a buccal insulin, which is being tried. And then you have alternate delivery devices. You have Exubera, which is not used very much, but Afrezza is used in some select patients, where you can actually inhale the insulin in a dry form. Simultaneously, while the insulins were being developed, there were rapid improvements in the delivery devices. In the good old days, we used to boil the glass syringes and produce a lot of infection because you can never really boil. Then came the disposable syringes. Then came the better and better syringes with smaller and smaller needles. Then came the jet injectors. Then came the pre-filled insulin cartridges. Insulin pens then came along, which makes it much more easier, user-friendly. Now we have the smart insulin pens, which will even tell you how much of insulin you've taken, whether you've forgotten to take a dose. People forget. They take their injection and then they say, did I take it or not? Especially in older people. Just look at your device and it'll tell you when you took your insulin and so on. And these are already being used quite a bit, and therefore they're really smart insulins. Then, of course, came the pumps. And the pumps, the first pumps which came were in 1980s. And in 1980, we had already used the insulin pump. This is the first report that we had of insulin pumps, using insulin pump for 6 patients. And then we went on to get different types of pumps. And the whole dream, of course, was to get an artificial pancreas. This is me in Germany, while working in Germany as Alexander von Humboldt Fellow, working on the biostator. You can see how big it was, almost half a room it fills. And that's how big it is. And this lady is now connected through this, and insulin is given, the glucose is given. If the glucose drops, then glucose comes in, insulin is stopped. If the sugar goes up, insulin comes in, all this goes on. Today, we have got and we have already had talks in this meeting and more to follow, the artificial pancreas hybrid closed loop system. And for those of you, or the 780G of Medtronic, so those of you who have used this, it is really fantastic, because it virtually prevents hypoglycemia, and it is so good. Of course, all of this comes with a big cost. So to conclude about insulins in India, we have come a long way from the crude AB insulins introduced in 1923, which Dr. J.P. Bose was the first to use. Today, we have some of the best insulins and the best tools to deliver them as well. I started this talk with a picture of J.P. Bose. I thought, after writing the article on the discovery on the pre-independence history of diabetes in India, especially insulin, and coinciding with the 100th year of insulin, I thought now I must write a book about it. So this book was just published 2 days ago, 48 hours ago, and it's called Banting, Bose, and Beyond. And here in this book, I have traced how Banting and Best started, how it came to India, how JP Bose, I thought his name, when I wrote and sent it to people, they said, isn't it Banting and Best? I said, yeah, that's what the world knows, but we should know Banting and Bose. And so he must be now immortalized through this book. And so this book talks all about JP Bose, his discoveries, what he did, but it's not written in a historical manner. It's written in a story form. Most inspiring is how insulin changed lives of people in India. And I know that many people who are talking in this meeting, including Jaz Sethi and many others, are included as true heroes and heroines of India, because some of them have lived in this book for 60, 70, and even 74, 75 years after getting type 1 diabetes, and they're still alive. The oldest person is 90 years old now, has had type 1 diabetes for 75 years after getting it at the age of 15, and they're all covered. All their stories are covered with true stories, with true interviews done by them. It's a research book. Again, it took me a year to write this, but I'm very happy that it has been now finally out. It's now available for sale. You can buy it at Notion Press. We kept the cost very, very low so that anybody can afford to get it. And I hope every child with type 1 diabetes reads this book, because it's truly inspiring as to how people can live. And again, I think one of the big heroes of Indian diabetology who has been forgotten is JP Bose. And I'm very happy that Dr. Banshi and all of you thought of instituting an oration in his name, because his work, I think, will be and should be remembered for generations to come. So with that, I will stop. And if there is time for questions, I'll be happy to.
Thank you, Professor Mohan, for a very, very wonderful, very exhaustive, but very crisp oration, a journey which of almost 100 years you covered in about 30 minutes time. It was wonderful. This being an oration, we won't have any question. I'll hand it over to my co-chair, Dr. Saurabh Mishra, to do the proceedings.
Thank you, sir. Thank you. It was immense pleasure listening you all throughout. You have been a mentor to us. So what I think, so my words always come out from my heart. So I will say Banting, Bose, and V. Mohan. The next published in our era, when I'll be reaching your age, if we'll be talking about, you will be the real hero of the real world at present in our country. You have shown us the technological path, and you are the right person to be honored like that. So Benting, Bose and Dr. V. Mohan. This will be, I think so, the book which we will try to launch when we will be at that level at which you have launched this book. Lovely book. We all will take the pleasure of reading this book. And sir, further, one few questions which come to us in our mind is that interruption basically. So sir, one question which always comes to in our mind is that as insulin is evolving day by day, the molecule of insulin is changing, the delivery devices are changing. But sir, do you think that is there going to be an era with technological management, artificial intelligence and self-management education programs that near coming future we will try to tackle the things quite more early in pre-diabetic situations so that it should not let it occur?
Type 2 diabetes, of course, it's already happening. Type 1 diabetes, also it is happening. They are discovering the stages before the overt diabetes comes, when GAD antibodies are positive, when already the beta cells are beginning to decline. Monoclonal antibodies are being used to prevent it. The results, as everything, takes time, but at least they're preserving the C-peptide now. They're not able to completely prevent it, but that's because we're not starting early enough. Those of you who were at ATTD in Barcelona and listened to Del Prato and others, it's because we are not starting early enough, because we're not able to identify them early enough. Only when the symptoms come, they come. By the time the cells are gone. So we must have mechanisms of screening, particularly the relatives, and particularly if the HLA typing can be done and can identify who are those who are going to get. Then if you do the GAD antibodies and find they're positive, you can probably intervene at that stage and prevent type 1 diabetes. The other thing which can happen and will happen, I'm sure, I hope it happens in my lifetime, is a total cure of diabetes. So people are working on that. The stem cells or therapies are going quite fast. And already the first person has been cured in Boston. 60-year-old is now completely gone off insulin. But everything takes time because we have to be sure about these. And there should be no immunosuppression. So if you're going to give immunosuppression worse than insulin, you might as well give insulin. So that is why the field in human things, and rats you can always show something, in mice you can show, but in human beings it takes time. But I'm sure in our lifetimes we may see type 1 diabetes going away. The old cases may be there, but the new ones coming may go away. Antibodies, vaccinations against type 1, all these are people are working on it. Every one of them, people are working on it. But we have to find another Banting who was born. It's certainly not V. Mohan who's going to do that. But another Banting has to be born. A mad fellow. Banting was totally mad, in my opinion. So another madman has to come, because normal people think normally. Only mad people think abnormally, and they are the people whom we need. Einstein was like that. Everybody was like that. So we need more of mad people, and who can go completely crazy and think of something else. And I'm sure they will be born, and probably they're already born. So let's
thank you, sir. Thank you, sir, for that. Those encouraging words. Sir, you said right. There is always a discovery. Nothing comes from outside. It is everything from inside. You have to search your brain, do a discovery. So we need a discoverer to discover the new things. It is all set inside our brains. You said it right, sir.
Correct. Yeah.
With this, I would like to hand over the session to my co-chair, Dr. Rajiv, sir, for closing remarks. Sir, please.
Thank you, Dr. Saurav. Very, I think very beautifully you kept it, and you pointed out that the next book, I think we'll have to take that project. That next book should be on Benting, Bose, and Dr. Mohan. I think that was the dialogue of the day. But the very fact that you have given a very rosy picture about oral insulins and maybe a cure for type 1 and type 2 diabetes seems to be very, very inspiring. I think with those little remarks, I'll close it and hand it over to Dr. Rakesh Parekh for...
Rakesh, say something.
So the ceremony is pending. The shawl.
Yeah, I said that felicitation, shawl and citation, something to be presented.
Yeah,
maybe virtually, but subsequently you may then send it to sir.
Thank you.
And sir, I would just like to add one thing, that at least we can do one thing from next year when we are going to present this JP Bose Oration to another stalwart in the field of diabetology. We are going to include the book of Mohan sir as a part of citation in that ceremony.
Wonderful, wonderful. I'll be happy to do that.
I think
Those of you who are coming to the RSSDA research retreat, I'll try to get some books. I have it right here.
I think let
I've got only the first few copies, so I'll ordered more. So I'll try to get some.
Dr. Mohan, let it be the faculty mementos this year.
Oh yeah, sure. We'll do that.
Yeah,
so let me know how many copies you need, and I'll be happy to bring it. And I'll do that.
Let it be the best faculty memento for everyone.
I'll do that.
Thank you.
Thank you. Thank you so much.
Thank you, everybody. So I will end the session.